stand for the pledge, please?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I really enjoyed it with your dad on
You need a roll call, Vicki?
CCA.
If you would like. I'm Lisa.
Sure. Start with the roll call. Here?
Mike Brickner.
Here.
Greg Sims.
Present.
Robin Lane. Here. Mitch Peters.
Here.
And our non-voting members, township trustees, Brennan Clancy,
Here.
Jesse Harper,
Here.
Ed Morales,
Here.
and George
Apple.
Topple.
Like fall down, go boom. It's easy to remember.
You have a full house. Everyone is present.
Thank you. We will be receiving presentations from Porter Stark Services this evening, Family Focus, and Housing Opportunities. Each of you will get 15 minutes to speak, and that 15 minutes will start as soon as you start speaking, so don't worry about coming up here and hurrying and get yourself prepared. And then there's approximately 15 minutes for Q&A. Okay?
And we will give
So,
a 5-minute warning. There's a 5-minute warning.
Yes, Kurt likes to, he gives that warning.
Official timekeeper.
But just wink at me and we'll pretend we all ignored it. We didn't hear him.
Scoring sheets?
We'll start with Porter Stark Services, please.
With our rubrics.
We have our scoring sheets.
Oh, you got our scoring sheets, Vicki?
Oh, for heaven's sakes. Okay, well, they can begin and I will go get them.
Yeah.
Deep breath. He was here today. Oh, no, I'm telling you. That lady was
You can start anytime you'd like.
Well, thank you. Good evening. My name is Matt Burden. I'm the president and CEO at Porter Stark Services. I have with me here Mary Itzstein, our longtime CFO who's recently transitioned to the role of Chief Administrative Officer. We also have several staff here from Porter Stark Services, and I think we're going to eventually have some board representation. You may be running a little bit late, but if there are other questions during the Q&A period, we've got a full team of people to help with that. But I'll get right to it because we have quite a few projects that we want to run through in relation to this request. We can go to the next slide, please. As a brief overview, we have 4 different requests, 3 expansions and 1 that is a new service line that we're looking into. So the first is our Recovery Center Valparaiso, which you may be familiar with already. It's been established here for over 10 years, and this is our certified opioid treatment program that specializes in methadone and medication-assisted treatment. And what we're looking to do is to move our current location, which is a very tight quarters, just 2 doors down the street from into a new building that we just bought that actually was Kids Alive International. So that will actually double our square footage there and allow better access. So that's one. The second is an outpatient clinic remodel. So most of our services on the psychiatry side and the therapy and counseling side are done at 601 Wall Street in Valparaiso. That space, we have some staff there who are administrative only, and particularly it's health information and data analytics. We're going to move that entire department, and that's going to allow us to build 12 more counseling offices there. Of course, the challenge then for the future is finding the number of workforce that we need to fill that, but you have to build it in order to do that. So that's what we want to do there. A third expansion is to do integrated care. We have a clinic in Hebron in the south part of the county, very rural in nature. And this project started just a couple of years ago when we bought the practice from a doctor who was there who wanted us to come in and continue to provide that level of service to South Porter County. One of the things Porter Stark is new to is primary care, but as part of behavioral health more and more, the movement is to integrate primary care with that. So we work with primary care providers in the communities and other organizations, but we also do some ourselves. So we found pretty quickly there's a big need there. We have the opportunity to double the square footage of that. And then finally, the 24/7 Crisis Center, which would be a new program. With the move of the Recovery Center from its current location, we will be able to actually use that space to have 24/7 in-person people who can be there and assess and get people triaged to the right place. Currently, this happens with cooperation from the hospitals where we go and deploy there to the unit, to the ER. We would continue to do that, but this would be an opportunity for people to come in, potentially to walk in and get placed into services. So I'll discuss that a little more in depth, but that's the overview. I know it's a lot to go over, so I thought I'd at least talk about it twice. But briefly, first, a little about us. Next slide, please. I think as most of you know, we are the Community Mental Health Center for the county. We've been here since 1975. We provide a comprehensive scope of mental health services, including integrated care. Our current staff count is a record number of 320 staff. It's up from 250 from just a few years ago. We are a 501c3 with a volunteer board of directors, 10 people, and an annual budget of around $35 million. That's grown by about $15 million just in the past 5 years. So we've continued to grow as much as we can to meet the need, but I know all of you know there's a lot of need out there. So the rationale for the particular requests before you today are to really address the most pressing issues that have been identified locally, at the state level, as well as nationally. And those include rising suicide rates, drug overdose deaths, and access to mental health treatment. In our business, it's very rare to find brick and mortar funds. It's the hardest thing to find. You can find ways to get operational funds, but very rarely can you find an opportunity that someone will pay for an expansion. So we thought this would be a unique opportunity to bring this to this committee for consideration, because anything that we can pay for in that way is more that we can invest in our staff and programs, and that's how we can ultimately be sustainable and meet the demand. So as you would probably hear from any CEO in healthcare or behavioral health, the number one concern today is workforce and finding the qualified staff and keeping them happy at their job, keeping them not burned out, and continuing to grow that qualified workforce as well. So, next slide, please. You can see in the picture here our current entrance to the recovery center. You may recognize that, and that's the same entrance to our inpatient unit. It also shares an entrance with Midwest Academy that's there. So it's a very busy intersection at times. On the right is the Kids Alive building, just a couple doors up the block. Next slide, please. And as I said, what we propose to do at the new location is really expand the square footage we have currently. We've been blocked into that same space for quite a bit, trying to work within the brick and mortar parameters that we had. It was about 2,200 square feet that we've been dealing with, but as the program has grown, you can see in my notes here that there were 624 individuals in Porter County that received medication-assisted treatment last year. And just as a quick side note, there were actually over 8,000 people in Porter County that received services from us on the mental health side. That was about a 12% increase over the prior year. This would allow for a third dosing window. It would allow for twice as many counseling offices, more group room space. We'll have better waiting areas, better parking, traffic flow. And importantly, it would free up the space that's currently right there next to the inpatient center, so we can put in that crisis center that I mentioned as our fourth project here. These types of renovations are pretty extensive. They involve the DEA, they involve state government, they involve all kinds of regulatory bodies. So it takes time. We have to do things like build steel mesh walls and meet regulations for this level of treatment. We are on track in terms of the timing of this to be there by around mid-February 2023, and the estimated cost for this project will be $848,000. Just a quick next slide, that's to show you, this is a draft sketch. We're actually finalizing the sketch. The state has to approve this, but this is just to show you that we're moving along, not to study it too closely. Okay, if we can go to the next slide. Just briefly, this is our outpatient clinic at 601 Wall Street in Valparaiso. All we're doing here is moving some people out and building offices, and that's it. We're going to make room for more licensed counselors and clinicians to do the work that they do already, and as I mentioned with the growth in client volume, it's definitely needed. We've fortunately been helped a lot by telehealth because we've been able to meet some of that demand, but I think as more and more people want in-office services, we want to be able to accommodate that. We expect this to be completed around spring of 2023 at a cost of $120,000. Request number 3, we can go to the next slide. That is our building in Hebron, so if you're ever going south on 2, you will see it. And this is the clinic that was established there for a long time that we're now providing primary care and family medicine from. We're doing some behavioral health, but we really need to do more. There's also a big need in that area for dental, particularly for the Medicaid population that we serve. And so we're looking there at what would effectively be double the square footage that it is now. And thank you for going to the next slide, because that's exactly what I need. We opened just there in 2019. Our annual clients served in most recent year was 940, but we expect that to increase to about 2,000 just based on our projections. This project, we actually do have some federal grant dollars from the American Rescue Plan Act of $540,205 for a $1.1 million total project cost. So there is already a contribution. So the remaining dollars on that project are about $595,000, and we anticipate that to be completed in the spring of 2023. So we have a lot of projects simultaneously that we're trying to get on track to move fast here. And the next slide just shows the existing square footage there in the color photo, and then the sketch of what will be the new space of around 3,400 square feet additional space. Okay, and finally, our request, there's that entrance again. This was where we would have our 24/7 crisis center. This would be a new program. And I can tell you we've spent a lot of time studying this. We've talked to our colleagues in Bloomington. There's a place in Logansport that does this. We've tried to research national models to find a way to get people kind of an interim level of care. And I'll give you one example that you may be familiar with, is if somebody's on the courthouse steps causing a problem and the police don't really want to arrest them, but they don't have anywhere to take them to get treatment at 2 in the morning, a crisis center is somewhere where the police can take someone and they can talk to a live person, and what happens often is an officer will say, you can have a choice. You can accept some help here from these people, or you're going to have to go to jail. And from our colleagues, they say most of the time people are willing to stick around. But it's much different if you're an officer who has to leave that person, decide not to arrest them, and just count on them hopefully getting help for themselves. Oftentimes there is a housing security situation. What this is designed to do is to not be a bed. It would be immediately adjacent to our inpatient unit if a bed was needed, but they have more of a model where it's recliners. So if it's the middle of the night, people have a safe place to stay, and they can, if they need to, sober up, do anything else that they need to stay in a safe environment until more people can come to help in the morning. So the next slide describes that a little bit more. We actually have applied for several grants. Often in this business, you have to build the plane while you're flying it because our funding isn't always certain, but there are many grants we're applying for to do this, and Indiana is actually moving towards a reimbursement model where there would be sustainable ways to support this type of program. That primarily occurs through what is called a certified community behavioral clinic model. This is something that's happened nationally, and it creates a national set of standards that all community mental health centers could adopt as best practices. So Porter Stark has been involved in this as a pilot program. We currently have an active grant for CCBHC, but we expect the state eventually to move to this as a model. And it's going to support things like mobile crisis, this kind of crisis care. It's going to support things right now that aren't able to be funded for our population. So we're excited about this, and we want to move in this direction. In the grant, we expected to divert about 100 individuals with behavioral issues from jail. The way we would count that is just how frequently an officer comes and takes somebody and comes into our care, and up to 250 from the emergency department. And while that might sound like a lot, it's actually not. We go to the emergency department about 1,600 or 1,700 times a year to work with someone in crisis on the psychiatric side and get them placed to our unit or units around the surrounding area. So this model is called No Wrong Door. That's what we're trying to achieve here. It will hopefully free up law enforcement to do other things, and it will lower costs for the criminal justice system as well as the hospital. As I mentioned, our sustainability we expect to be through CCBHC in the future. We would like to have this also completed in the spring of 2023, and the estimated cost there is $312,500. So I've not heard a 5-minute signal.
Yeah, I didn't want to interrupt you. You're at about 2.5 minutes.
2.5, okay. I just wanted to check. I thought, wow. Maybe I was talking even faster than I thought.
10 minutes under.
Good, okay, well.
Trying to be in the rude one.
No, actually, thankfully, I'm at the summary and conclusion slide. I just wanted to say thank you to all of you, because I know this is a big effort on your part in hearing from everybody, and there's a lot of great projects out there. So any support we can get towards doing this would be a great help. And our total request is around $1.8 million. So at this point, I'd be happy to take any questions.
And that will conclude the presentation portion of our time here. We'll start with questions. Board members?
Real quick, so the 24-hour crisis center, now, usually if a patient comes in and they're, going through withdrawals or wanting alcohol recovery, they're vented at the hospital first and cleared. Now, would you guys be taking over that process for the hospital, or would that still be going to the hospital first and then going to you guys after?
We will always work with the hospital. If there's a medical priority, that's going to be taken care of at the hospital. It's just that there happens to be a lot of cases that really don't need that level of medical clearance. So as long as we're working closely with the hospital, we would have someone, either a nurse or a doctor there, that would be able to just make that decision if the person needed medical care at the hospital or whether they were clear enough to be admitted in that environment safely. And then we would, if we have to, we would call an ambulance, of course.
With any of the 4 projects that you presented today, how far along are you contractually with any of them?
Well, not in terms of construction, we have not done that because we're just getting ready to submit bids for the Hebron project. We
have paid architectural
Yeah, it's mainly just
fees.
architectural.
Yeah, is really where we,
With all 4?
no, with the recovery center and the integrated primary care, the Hebron expansion, we have done that.
The purpose of me asking that question is that we have time constraints on when this money has to be encumbered.
Yeah.
And you're certain that you can meet those time constraints?
Yes.
If you were, okay.
Yeah.
The next question is if you were to receive less, would you accept it?
Yes.
Kind of a silly question, but I got to ask.
We will definitely appreciate any support.
Thank you.
I have some questions. Is the Crisis Intervention Center, is that dependent upon the movement of the MAT
Yes.
facility? But that's going to happen.
Yeah, it really kind of fits in nicely because that is already a tight space. It shares that entrance with the inpatient unit that can be kind of disruptive at times when there's a lot of people that need it at once. We needed the space to grow. As you know, it's a red brick building. It is what it is. It's built on a hill. You can't really engineer your way out of that. So if we want to be able to accommodate a growing patient base, we needed more square footage. And then that would then free up that thing right next to the unit where it's just exactly where we would want to have that.
And that's all part of the Crisis Intervention Steering Committee that we're all participating on in the community. Is that going to be part of that?
I think it's definitely related, because I think in terms of CIT, like the Crisis
Right.
Intervention Team training, that would hopefully be a route to educate the law enforcement and other people who would need to know that this is part of that solution from the law enforcement, where law enforcement and mental health meet.
And that eventually, or theoretically, is going to include all of the police departments throughout the county.
Yeah.
The goal, I believe, is to train all of those officers.
Yeah, if they're willing to do it. And I know it's a time-consuming process, but very, very valuable.
But it's another one of those things, once you build it, they'll probably be a little more conducive to participate.
Yeah, I hope so. I think that from our experience, whether a community has CIT or not, as long as you are talking with the officers, they're going to be running into those circumstances like I'm talking about, and we have good communication at that level to let them know that this is going to be an available option.
The biggest issue with mental health care right now seems to be, from an outside perspective, the availability of staffing, therapists, psychiatrists. Do you feel that your expansion I mean, realistically, are you going to be able to staff it?
Well, I hope so, and I base it on the past 3 years, and I'll compare it actually to the pandemic. Start of the pandemic in healthcare, you've seen 500,000 people leave healthcare in the nation. That's a 2.7 reduction in workforce from the time the pandemic started. Porter Stark in the same time has grown by 12%. So we're hoping that we can do this. We have programs that we work with interns, we do practicum for people. We've got a graduate medical consortium that's going to hopefully develop psychiatrists right here in Lake County, right next door, that hopefully some of those will stay. So I think that there is an emphasis on the workforce. It's going to take time, though. That's the issue, but we have to build for the future.
As I spoke to you just prior to the meeting, the Board of Commissioners and the County Council, we had a comprehensive, contracted out to have a comprehensive mental health study done here in our county for the purpose of trying to get us, everyone, a better understanding of exactly what we're doing here. And if there's things that we can do better, what are we doing well, and what we could do better. And that presentation is going to be on the 17th for those who would want to attend, beginning at 10 a.m. That could very well be a boon for you.
Okay.
Depending on its results.
Sure. Well, we've had the opportunity to meet with her, and she's been terrific and followed up with us several times on issues. So I think she's collecting a lot of really good information.
Now, one question about the crisis center is that something that I could, that our residents can utilize if there's a situation at home when we just put that person in a car and drive them over there?
Yes. I mean, if that person were in crisis, I mean, it is designed for that.
Right.
But yeah, absolutely, it would be for anybody.
Okay.
Not if we're just tired of them.
I don't know. I'll have to consult with our clinical chief.
That's a great question. Any more questions from the board?
You had mentioned that it would alleviate roughly 100 people from the jail and 250 people from emergency rooms. What is that number? Is that
We put these in
capacity
action.
a day? Is that?
No, I'm sorry, that's for a year.
Okay.
And so we would, and we put these numbers in because we are hoping to get grant support behind the staff hiring for these. And in order to do that, you have to put in grant goals. And so our team got together, and based on the volume that we currently see at the hospital, we thought, I think we can get at least this number. That's what they came up with as a plausible goal.
What kind of matching funds have you put toward these projects up to this point?
Yeah, what we did, we bought the building that you saw, Kids Alive. So we're currently renting it back to them for a short duration. So that was a pretty major investment in that move. That was the biggest thing. Mary, are there?
Well, we've got a HRSA grant for the expansion for the Hebron. So we own that property, and we have a grant that we're committing, we had choices for that one, and we are committing it to Hebron. So, but we haven't, we haven't started building or anything like that. We actually had to have the property annexed because there happened to be 2 lots adjacent that we owned, and one was county, one was the town of Hebron. So we just finished that process, so that kind of delayed it a little bit.
Yeah. Oh, so the other investment there was that building, and also actually the 2 adjacent plots to that, because we needed that for parking in enough space, because it's very tight in that place at certain times of the day.
Right. So, I mean, clearly, these types of projects you're going to increase your operations. At the end of the day, that's what you're doing. And I think that you answered my question about just the state's program that's being created, we're being used as a pilot. Is that something that you're depending on to help sustain these additional operational costs?
In part. So this has actually been, this movement with CCBHCs has gone from Porter Stark being one of 2 pilot in the state to now we actually have, I believe, 18 of the 24 community mental health centers doing it, and the other 6 that are now trying to get the most recent grant. From a federal standpoint, the federal government has really prioritized CCBHCs across the nation, so it's a good way for them to get funding. And as I mentioned, the good thing about it too is it creates a standard for everyone, because a community mental health center in a state is really very state specific. If you take a federally qualified health center, all of the standards and outcomes that they look at are national and they're uniform. So it's very hard to compare mental health outcomes across states when you don't have a uniform process for doing that. So this would align those best practices. And so aside from the grants, though, the state actually passed some legislation this past session to do a study that would be a comprehensive study of a CCBHC financing mechanism that they're expecting would be in place by 2025. And in the meantime, if that doesn't happen, we do have still an existing system with some flexibility that we'd be able to bill at least some of these services. And because of the movement, we think that there will continue to be grants out there.
I ask you, I mean, I kind of get the sense that the state, each passing legislation, that we're getting closer and closer where they realize they need to play a bigger role here as far as the helping, with the financing of these programs.
Yes.
And complexes, but that's always great. I got one last question. Have you received any COVID or pandemic funds
Yes.
to date?
We have. We've, aside from what we would classify the funds that we've already received towards Hebron as that, but over the past 2 years, because we're a hospital, we're a CMHC, we're an OTP, we're an FQHC, you've got funds coming in. I just did want to note that every single one of those dollars has to be accounted for, and if it's not approved as a COVID-related expense, it's not reimbursed, and all of that money is now past history. So we were able to successfully receive funds and draw down the funding that was available based on the expenses we had.
Yeah. Well, since you brought it up, hypothetically tomorrow all these projects are completed, and we would have another pandemic. How does those projects help your organization service the public?
Yeah, I think if we had another pandemic, I would expect another end to the pandemic and people coming back for in-person services. And in the meantime, the good news for mental health and behavioral health is that we're able to do a lot more in telehealth than we used to do. The flexibilities have been greatly opened up. And we will have that as a tool to continue. And when that tool is up, and always I wanted to point out too, Porter Stark Services has never closed our doors. We've always been open for in-person services throughout the pandemic. Some staff weren't comfortable, and we were able to adjust and have them do telehealth because there were enough patients that weren't comfortable and wanted to do telehealth. So we've been able to modify the demand that way and meet it. So I think as the community grows, you're always going to have some need out there. So I don't think it'll be a waste of space.
Can I ask one more question?
Absolutely.
And all of these programs, as I understand them, are the very types of things that we saw resultant from the pandemic as emerging crises or increase of volume. And these types of projects, every one of them would continue to function and operate through another pandemic, wouldn't they?
Yes, absolutely. Yep.
Well, thank you very much. Great presentation.
Thank you.
Learned a lot. Wish you luck.
Thank you. And
Thank you.
again, appreciate everything that all of you are doing. Thank you.
Next up is Family Focus.
Thank you.
Oh, thanks.
Thank you.
We've got a lot of paper.
You guys got a folder, so you got my vote, all right?
Of course, he is a non-voting member.
Every vote
We have
counts.
flashlights, too.
Start whenever you're ready.
Okay, thank you. Hello, my name is Cece Payne. I am the Chief Operating Officer for Family Focus, and with me today I have Spencer Luswig, Manager of Clinical Services, and then we also have our Executive Director joining us. He's sitting there for moral support. We submitted our proposal only to this committee, but like other agencies that have submitted their proposals to this committee, we were unsure of which category was best suited for our submission for requests. As we both represent a nonprofit and also a mental health and behavioral health and a social service provider. We are trusting that the subcommittee consider our proposal under the most appropriate category after our presentation. Next slide, please. A bit about us. We are Family Focus. We began in 1989 as a non-medical, home-based crisis program through the VNA of Michigan City. We continued doing business under the umbrella of LaPorte Hospital after VNA merged with the hospital, until we broke away and became our own self-sustained nonprofit agency in 2003. Although over the years the service titles have evolved, we have continued to provide an array of community-based programs within crisis intervention, prevention services, and parental education. We have provided services to over 10,000 families in northern Indiana. We also have a workforce that's currently at about 70 here in Porter County. Next slide, please. Some of our longer-standing partnerships include the KIDS program with Newton County, which is an intensive home-based social intervention program. We also are represented on the Child Protective Team there as well. We have an MOU with LaPorte County Courts for their Youth Wellness Court Program, which is a 6 to 12-month court program for youth offenders. And we also have an MOU with their Family Recovery Court. This is in effect to reduce the termination of parental rights among child in needs of services cases that coincide with substance offending parents. Part of our current strategic plan is to grow our collaborative partnerships, especially within the counties that we serve. This has resulted in our two newest partnerships this year. The first one is with the Caring Place. This collaboration has resulted in the sharing of resources. For Family Focus, we will be receiving specialized training on domestic violence victims and going through the shelter. And in turn, we will be providing therapists at the shelter to address the mental health of the clients there. Next, through a new state-led initiative, My Healthy Baby is aiming to link together pregnant women to family support providers in their own communities through birthing hospital and doctor referrals to create healthier outcomes for both mom and babies. Currently, Family Focus Healthy Families program is the only evidence-based, home-based preventative program in that 5-county area. Slide, please. Just to let you know a little bit more about this, we have an addiction service provider outpatient certification through DMHA, and we have achieved accreditation through CARF, the Commission on Accreditation of Rehabilitation Facilities, under the Youth and Service Programs section. Next slide, please. Our most recent venture is Family Focus Service. This is a counseling center that started up just last year as part of our strategic plan. And the purpose of our Life Focus Counseling Center was to address an unmet need for mental health counseling services within our service area. Next slide, please. So the first picture there is a map of Indiana, and the outlined area is our current service area. The little black flags represent locations in which we have supervised visitation offices for court-ordered supervised visitations, and we also have space within those facilities for counseling services. However, we are headquartered right here in Valparaiso, Indiana. And that picture right there is a picture of our building, in case you haven't, you're not aware of where we are. We're actually located right off of 30 behind Binder's Jewelers on Route 30. Next slide, please. So why is the location important, other than demonstrating that we are eligible for ARPA funding? It has to do with that little purple area right underneath the Valparaiso sign. This is unique to Porter County because our location in that little purple area under Valparaiso has been designated as a qualified census tract. And in Indiana, that also is considered an opportunity zone. That purple area there is only designated for for qualified tract in Porter County. So within the whole county, just that little purple area is the only designated qualified tract within our county. Throughout the final rule, Treasury refers to those households, communities, small businesses, and nonprofits that experienced disproportionate public health or negative economic impacts of the pandemic as disproportionately impacted. As a nonprofit, the bulk of our revenue actually comes through contracts with the State Department of Child Services. Our main source of revenue is reliant on contact hours with our clients. This equates to face-to-face interaction. Over the course of the past 2 years, this has been negatively impacted due to COVID. Whether it was our clients who were out ill or who had close contact or that fell on our staff, our contact hours were severely limited. We had a workforce that was on payroll, but we were not getting the revenue needed, not only to sustain operations, but also to continue to grow, and in particular, to grow our newly founded counseling center. Next slide, please. Okay. So what are the issues that are being reported within our states? The greatest impact of pandemic-related stress on our population, per the Center for Health Policy at Indiana University, remains at elevated levels. Elevated levels of stress, anxiety, fear, and isolation have been reported due to the pandemic. This has been linked with illness and death associated with COVID-19, but it's also due to mitigation strategies such as social distancing and stay-at-home orders. As mitigation strategies and the spikes of COVID have somewhat waned, we are now seeing a series of cascading social and economic effects continue to ripple throughout our communities. Parental burnout is huge. It is a chronic condition that is characterized by high levels of stress due to the imbalance between the demands of parenthood and the limited resources to facilitate parenting. Some of these factors that contribute to parental burnout include things like unemployment, financial insecurity, and even just the limited social supports of friends and families because of stay-at-home orders and isolation. Parental burnout can have severe implications on the health and well-being of children. A higher level of burnout is a risk factor for child abuse and neglect. Unfortunately, there is also a correlation in parents' worsening mental health and worsening behavioral health of their children as well. This has led to increases in things like suicide, substance abuse due to pandemic-related stress, and within intimate partners, the state has seen 181% of violence-related fatalities over the 2019-2020 period. Slide, please. Unfortunately, we continue to have barriers to mental health care, such as costs and coverage limits. Slide, please. Besides costs, our greatest barriers are access, as were mentioned earlier. Access to obtaining care. Porter County has been designated a medically underserved area in mental health and primary care since 2002 by the Health Resource and Service Administration. Our county also is a health professional shortage area designated by the same administration. This is designated as having shortages in whether it's primary care, dental, or mental health care providers. Next slide, please.
Okay, so this is our proposal. Family Focus can help fill gaps through creative partnerships with Porter County agencies. This proposed program will assist in meeting community goals by providing extra therapists and parenting education or peer support groups through our Life Focus Counseling Center. We'd form stronger collaborative partnerships with the county in which we operate, Porter County, and this would include reaching out to the 7 school districts and offering our wraparound services. Family Focus would also seek to strengthen partnerships with the courts, probationary, and correctional agencies. We'd like to expand our current court-ordered classes for divorcing parents, which is trans parenting, to include parent education for young and teen parents or classes on fatherhood engagement. We'd hire therapists
Each therapist will work with Porter County residents that are referred through courts, schools, hospitals, and other community partners to receive individualized therapy and services as defined by the treatment plans and using evidence-based approaches. This funding builds on our existing services and would only support and supplement existing community-based services by making more services available to county residents. This makes it possible for individuals experiencing mental health crisis to receive the care they need when they most need it. Finally, all life-focused therapists who have not yet been trained would receive training on eye movement desensitization and reprocessing therapy. That's EMDR. It's a mouthful. I apologize. I'll say EMDR moving forward. Several of our therapists that are working within our crisis services have already been trained and have had great success treating trauma with their clients. Slide, please.
Remaining.
5 minutes. Slide, please. Oh, wait, no, you did that. Great. So EMDR, basically, it's a therapeutic technique used to help resolve traumas. Essentially, if this is your brain, your fingers are your higher functioning, your brain is your crisis response. So when you receive a trauma, pretty much you blow your top here, you can't think and use your crazy rationalization skills that you have, and those traumatic memories get frozen in that lower functioning. That survival stuff makes it very difficult. EMDR really helps the brain to heal itself and get through that stuff so we can keep moving forward and recover from trauma so we can heal the right way. Slide, please. With the exception of the Nurturing Fathers programs, these are some of the evidence-based practices that we utilize now and continue to utilize through our crisis program and through life-focused counseling. Slide, please. By partnering with educational, governmental, and law enforcement services in our area, we'll be able to help address increased demand for mental health professionals that come with being designated a MUA. We'd help provide any outcome data on partnerships from ARPA projects. We'd support for our community by offering parenting, education, and groups. And with our new therapists, Porter County clients with the greatest need would be prioritized. They'd receive the needed services when they need them and avoid long waiting times and not have to worry about out-of-pocket or network costs to get the help they need. Next slide, please. Our funding request is $333,950, and this would support education, groups, training, and therapists. Next slide, please. Proposed project has a planned 2-year timeline, and there's a slight update from our PowerPoint slide since it appears the decision on funding would not be made until later this summer. So if awarded funding, recruitment and hiring to occur in the fall, training would occur in the fall of 2022, and direct counseling services to clients within our life-focused counseling would occur between the fall of 2022 through the winter of 2024. Groups and parenting educations would also occur over that same timeline. Next slide, please. Life-focused counseling will continue to operate and provide counseling services and offer our clients continuity of care after the grant ends. Through established partnerships, we continue to work with Porter County. Next slide, please.
And apologies for the tiny print, but this pretty much summarizes how we would be meeting the priority considerations. And this includes our request directly meeting the Treasury's final rule and focusing on issues pertaining to behavioral health, substance abuse, preventing and responding to violence. This is a one-time request with a sustainability plan for our counseling center to continue on. We would leverage our matching funds in the space of the current facilities that we have available, software credentialing. We would service a large number of people in Porter County. I didn't have the information in there, but from our parenting groups over the past 3 years, we have provided the transparenting course for almost 1,200 parents, so from 2018 to 2021. This would be an effective and impactful use of the ARPA funds. We can obligate the funds by December 31st, 2024. And then just a summary of the other ones, we would be in adherence to non-discriminatory policies, best labor practices, and we're currently in good standing with all our obligations through CARF, through the state, local, federal regulations. And finally, we're hoping that our designation within the qualified census tract would support our request as well. Thank you, guys.
Thank you. A couple of quick questions here. You service a total of 12 counties, correct?
That's correct.
Has any of those counties awarded you any ARP funds, or any of their ARP funds?
No, to my knowledge, so I'm kind of relatively new still. Quick, I might look back behind my shoulder to see if Jim has any knowledge of any other ARPA funding, but as far as I've looked through our books, we have not received any county ARPA funding.
Our main office is located here. We really want to focus on helping Porter County. We don't want to spread ourselves too thin because then you don't provide quality service. You want to provide quality. If you spread yourself too thin, I've learned from my 20 years of business prior to this, you can't provide good quality customer service. So we want to start here locally and grow and help this community through our home offices. I did hear about some of our funding in the report, but as I said, we want to prioritize Porter County.
And if I understand that you want to invest these funds into programs.
Correct.
So those are programs that are also, those programs are servicing the 12 counties.
So we currently do have, like, for example, a transparenting course. It's open to everybody, but with these specific funds, we would use those funds for Porter County residents, and we would verify that through what is it called, a residence verification process.
So they would be available only to Porter County residents.
We could definitely hold classes specifically for Porter County residents and continue our other classes, like open to other counties. Just looking back at the data, we have had families who have participated in those classes from several counties, but in order for simplicity, we could definitely hold like Porter County classes.
Have you received any pandemic funds from anywhere?
I do know that we applied and received a PPP loan, and the most recent collaboration with the Caring Place, we did receive FIPSPA funding.
Okay.
We did receive PPP money. We did receive PPP money because we did not lay off anybody during the pandemic. In fact, we hired more staff during the pandemic because there was a real crisis and a need. We did a lot of teleservices at that time because of the start of the pandemic. We are, by the way, 24/7. Most of our services are home-based, so families don't have to come to our offices. We can go to them. We did get the PD money. We did get a small loan and we paid it back. The loans were going out of that during the time of the pandemic. So, yeah, we did put that money in good use and increased our staff. So, also, during the pandemic, we were one of the providers, because people were losing and they're paid by the hour, our field staff are, we provided them an extra 2 weeks vacation pay so they could pay their bills at that time.
Thank you.
Is all your therapy EMDR based, or do you do any traditional talk therapy? And is there someone on staff who can prescribe if needed?
We don't have anybody on staff that can prescribe, medications. We have a slew of different types of evidence-based models that we're trained in. So EMDR is, I'll be honest, the one I'm most passionate about, but we have trauma-focused cognitive behavioral therapy, combined parent-child cognitive behavioral therapy. Some of our staff are trained in dialectical behavioral therapy, cognitive behavioral therapy, but as far as therapists. And then for our caseworkers and parent educators, they're using curriculum to provide that kind of education to improve the parenting.
Do you have any type of matching funds that you would be coupling with these funds in order to develop these programs and see them finished out?
So the matching.
Or I'm sorry if I finish here. Or is it these funds that you're totally relying on to develop these programs?
These programs are already developed. We have the space, we have the facilities. We do have a very small but mighty operating counseling center. I think at this point we're trying to grow the counseling center, so this would be a part of our growth strategy.
Remember, these would be able to be self-sustaining.
I'm sorry?
programs? These would be able to be self-sustaining programs?
I think so, yeah. Afterwards, I mean, we would continue to carry on with the classes that we're still doing, with the counseling center that we're still doing. I think right now, what our county needs is a little bit more support. So at least for the next couple of years, as we're still kind of waiting through this pandemic, that this would definitely help fill in some of those gaps.
Well, that is a question I think that Robin had kind of touched on here, is that if you were awarded these funds, and then you go out and you make larger these programs that you already have in place. Once these monies are spent, they're spent. I mean, Porter County is not going to be there next year. So how do you sustain yourself? What's your plans for, filling in that gap that you have now created?
Sure. So, as a nonprofit, I think, other nonprofits can speak to this too. We're aggressive grant writers. At this writing, within the first half of the year, we've already written for and been awarded 2 grants. One of them was, again, the FIPSPA grant, but the other one was not. It was just to expand programming. So definitely to continue that strategy. But also because our counseling center is seeing a little bit of a growth beginning this year, we could definitely look at investing in some of those funds and continuing operations.
Are you done?
Yes, go ahead.
So as far as Porter County, who have you collaborated with in order to develop referral sources other than the caring place?
Sure, that would be our work before.
You do some work with the juvenile court system?
We do work with the juvenile court system right now through our DCS. Right, and so I think that we would be, and I don't know if you want to.
Yeah, so a lot of our referrals do come from the Department of Child Services and from juvenile probation. So when, in certain situations, even when a case maybe isn't going to be opened with DCS, they can still refer to us, they can send it our way, and our counseling center is allowed to work with them, but right now we just have limited availability for our people there. So we have strong relationship with juvenile probation and Porter County DCS.
I've got a question. You had mentioned about helping with the new births. Are you familiar? We had a presentation the other day from the Porter County Community Foundation doing exactly that. Do you ever, and I don't know if Porter Stark does the EMDR. I mean, I guess I'm thinking.
Everybody does.
Are we, okay, so is this just competition? You're trying to get bigger than somebody else? Do we all need, I'm just trying to figure out where the money, if it's going places, who's utilizing the best? How are our services for the whole county being utilized? And we don't want any overlap. I mean, I hope we don't want any overlap.
Sure.
But we want our people cared for.
Right.
So, I mean, are you familiar with all the other groups out there doing similar things?
I did watch the presentation from last week, the other nonprofit one. I know that we, like, for the first things first, I know that's an organization that our director has begun to coordinate and collaborate with. I don't see it as a competition, though. Again, as mentioned, we are a designated, medically a health shortage area for providers. I think that that will probably be one of our most difficult things, is to find qualified staff, as some of the other organizations are seeing, find and hire our therapists. I think right now it needs to be all hands on deck to address the cascading effects of what COVID has done to our communities with mental health, and then just everything that came before that, isolation, parental burnout. I don't know.
Well, I'm sorry, go ahead.
I was just going to say, but this EMDR therapy, it's more broad-reaching than just mental health, isn't it?
Sorry.
Isn't the EMDR more far-reaching or broader-based than just mental health,
I mean, EMDR is
addressing those issues?
it can address a lot, it's effective in
I
addressing
can
a lot
help
of.
you if you want. For instance, most addiction is just a manifestation of trauma, which EMDR directly relates to.
Correct.
So it's not just the mental health component, and we're all here in a situation where there isn't enough treatment across the board.
Right.
Would you agree with that?
Yeah, I would agree.
So isn't EMDR training and therapy opportunities across the board over and above just mental health? And how are you gonna market it? I guess that's my big question.
Okay, so I, as far as the mental health side of things, I view the substance use, all the trauma, all under the umbrella of mental health. And because like you said, manifestation of trauma, it's, as far as marketing, right now I think we all know people who have really struggled throughout the pandemic, and it's been a traumatic event for a lot of people, losing people that are close to them, or just major life changes and trying to adapt to all that stuff. So there are a lot of people out there that haven't had access to mental health services. And EMDR is an effective, when we talk about evidence-based models, there's a lot of support for that research and evidence that shows that works in reducing trauma symptoms. And that's one of the reasons why we believe in it. And we do believe that this pandemic has been traumatic. So as far as marketing, I'm not sure about.
Yeah, I don't know if it's so much marketing as having a referral source, and that would come with our partnerships that we build within our county.
But you've been here for all these years, and like everybody knows Porter Stark. Everybody knows a lot of the organizations that are gonna come in front of us. And I'm familiar with you just because I'm familiar. But that's a big issue, is nobody knows who you are, so how are you going to develop those partnerships?
So part of us being here is part of our strategic plan for sure. Like I mentioned earlier, I'm about 6 months new. I'm a Porter County resident myself. I've worked in POCO. I've worked in nonprofit, I worked in early childhood, I worked in social services, and to be honest, Family Focus was a new agency to me. Since the development of our new strategic plan, it really is hitting it hard. What can we do within the county that we are? And so, I think that just within this year, we have begun building those relationships. Our plan is to get out there to become known. That was kind of part of that. That was the whole purpose of that slide on collaboration, to let you guys know, like, hey, we have collaborations with all these counties, and we're right here. We're right here, right off of 30. How many people drive past us on a daily basis? We need to do a better job at getting our name out there and letting you all know that we're willing to help the residents of Porter County. We're here. We're extending our olive branch, or just letting you guys know that we want to be a part of this solution for sure.
Can I add something, please?
Sure.
I've been around, and I've been with Family Focus 28 years. So I worked in the field, and I worked my way up to executive director. I have made relationships with Porter County for many, many years here. I worked and talked and met with the Youth Service Bureau of Terry Place as a partnership. I know Jim McCurdy from Porter Stark, which is the child services there. I started a Northern Coalition of Family-Based Services, where I invite providers to come to the meetings quarterly, and we talk about collaboration. So we've really been focusing on collaboration, but our history has been focused on child abuse and neglect in our contract with Department of Child Services. So to market ourselves without prevention dollars, it doesn't work. So now we want to do the prevention. We have identified the dollars to do prevention. There are grant sources in the future that we can write for, to get grant writers, to continue this funding and continue these programs. But the collaborations have been made, and I've made them in this community and many other counties too. So I think we could do a lot with prevention. started father engagement services in LaPorte County, and then we were doing father engagement in the Porter County Jail, Starved County Jail. We were turning men's lives around, doing father engagement services. Times came out of the story, the improvements we were making with dads out there and father figures. And so parenting education is something we want to go into. The transparency program is for parents that are divorcing and teaching the effects of divorce on your children. So we're reaching out to potential donors because we don't want those families to go into the system. We want to keep them out of the system. It's too expensive. It's a lot of tax dollars.
Would you guys be willing to take less?
Of course. I think that as nonprofits do, we just do more with less.
Question time has expired.
Okay. Do you have a question or two for us before you leave?
No, I guess I just wanted to wrap up again by saying, even if there wasn't an opportunity to be a part of this funding, again, I think I would like to reiterate that we are here. I think that our focus is now on Porter County and making those collaborative, partnerships within our county.
Well, as I touched on a few minutes ago, county government has invested some resources toward better understanding what's going on here from a mental health point of view, and our goal, at least the people, the officials that I've spoken to, is to roll up our sleeves. Let's see what's going on here, and if there's something we can do on our end without affecting the services that the people expect us to by state law, we certainly should be doing it. So you're here at the right time, so.
Thank you so much.
Thank you so much. Good job. Next up, housing opportunities.
Thanks.
Thank you, sir.
Thank you, Jordan.
Thank you.
Yeah, I know.
Start whenever you're ready.
All right, thanks for having us tonight. I'm Jordan Stanfill. I'm the CEO of Housing Opportunities. This is Cheryl Sharp. She's our consultant on the project from Milestone Ventures. And we're here tonight to ask you for funding for two projects that we're working on. And to make it as confusing as possible, it's Providence Commons 1 and Providence Commons 2. Or there's a two-phase project that we're working on that are currently in the works. Next slide, please. So our development team there is the ownership group of Providence Commons LP, Providence Commons 2 LP, and Cheryl will talk a little bit about that in a little bit with how the funding source works for ownership. Housing Opportunities is the developer and property manager for the projects. We're working with local construction team of Shive Hattery for architecture, Great Lakes Engineering as our engineering group, and Core Construction as our general contractor. And then Milestone and Cheryl here are our consultant on the project to help us get through the state funding source that we use. Next slide, please. So Housing Opportunities, if you're not familiar with us, we are a local 501c3 nonprofit organization that provides affordable housing, supportive housing, shelter, and wraparound services to low-income, homeless, and people with disabilities in Porter and LaPorte County. And we've been doing that for over 20 years and currently own, operate, manage, and provide services for over 200 units of affordable housing, supportive housing, and shelter in Porter and LaPorte County. Next slide, please.
And, I'm Cheryl Sharp with Milestone Ventures, and we are housing development consultants. Our work is primarily to assist not-for-profit organizations in the development of affordable rental housing. And we've done that, throughout the state. We've been around for about 22 years, and we've been pretty successful in the work that we've done. We've helped develop about a little under $300 million worth of affordable housing and total development costs, which translates to about 2,300 units of affordable housing in 90 developments, of which 41 of them are tax credit developments, which we'll talk about a little bit more here in a moment, and 17 properties that have a focus on serving people that have experienced homelessness and also special needs populations. And we've been working with Jordan and Housing Opportunities for about 6 years. We began first with the Aurora View development, in which Housing Opportunities teamed up with our friends at Porter Stark Services to do renovation of 15 apartments serving people with mental health challenges, and also develop 8 new apartments for persons experiencing homelessness. So that was completed in 2018, and then we kind of rolled into work on these 2 developments that we're here to talk about today in Portage. Next slide.
And so Providence Commons 1 is currently under construction, so we were funded a year and a half ago, or summer of 2020, I think it was, or fall of 2020. So we're currently under construction, slated to be finished at the end of this calendar year. And so that is a 2-part project for us. So it's a total of 50 units of affordable and supportive housing in the city of Portage, and it's at 5 different sites. So part 1 of the project is to rehab our existing 38 apartments that we've owned and managed there since the early 2000s. So bring those up to efficiency standards in terms of energy and green improvements there. Fully rehab them, and then also have a new construction site on a piece of land in Evergreen Avenue in Portage that was donated to us from the Portage Resale Shop with the intention of using it for affordable housing over a long period of time. So we have a 99-year affordability commitment for that land donation to come to us. And again, it'll be 4 sites for the rehab, and then the new construction is a 12-unit apartment building for singles and families, and the construction of a community center to service our residents and the community. We'll talk a little bit more about the resource center in a little bit, but it will have services available for the entire community. And so service partners will be Porter Stark Services, NEO, the Portage Township Y, and others to come in on-site, provide services for our residents, other residents in need, and then the community as a broader in Portage as well. Next slide, please. Phase 2 of Providence Commons, which is we will go in for application to the state for low-income housing tax credits, which Cheryl will talk about in just a little bit, is the new construction also on Evergreen on the other side of the parcel of land that you'll see in a minute, of 36-unit apartment building serving singles and families, with the majority of those being open to people who are low-income residents of Porter County, and 9 of the units being supportive housing for those that are exiting homelessness and have a diagnosed disability. And again, it'll be a mixture of studios, 1- and 2-bedroom apartments on that site on Evergreen and new construction. And you can see the rents there that we typically charge for our units, and then provide those wraparound services from our staff and the community as well. Next slide. So this is, again, the architect rendering of the site with both phases. So the building in the back there is the Phase 2 36-unit building. The white building to the left is the existing Portage Resale Shop in Portage, if you're familiar with their operations. And in the forefront there is the 12-unit building and the community center there in front. And we're really excited about the community center. As Mr. Clancy could probably tell you, there's not a lot of homelessness and housing services available in Portage, in the city of Portage, and kind of North County. This will help us fill that need. So right now, if someone's homeless in Porter County, they really have to come to Valparaiso to get our services and many of the other services that are provided. So this would be a way for us to serve that need in the city of Portage, have meeting space, office space there, and outreach folks from our staff and other people can be there to meet with clients, to help them get into affordable housing or other types of services they may need, and then do assessments for homeless services and such that we do mostly in Valparaiso right now. Next slide, please. Again, this is just a site plan for the development, so you can see that. It's a little hard to read from or see from this angle, but another view for you as well. Next slide. And so this really meets the mission of Housing Opportunities to provide quality, affordable housing for residents in Porter County. And that's both for people who are just, a lower income household or family who needs an affordable place they can rent. Right now, as you probably know, rents are extremely high across the country, but particularly here in Porter County. And so we offer an alternative product for people to be able to afford on a lower income in their household. And the same thing for people who need those longer term supports and wraparound services, offering that service as a long-term housing solution to end their homelessness. And then, of course, providing all the other services we provide, which is direct outreach to those experiencing homelessness in our community, walk-in services, and establishing those service partnerships in the community with folks I've mentioned, whether it's Township YMCA, Porter's Retail Shop, Porter Stark Services, and other folks that we partner with every day. Next slide, please.
So the timeline is that Phase 1 is underway. We closed on financing late last year, began construction early this year, and are well underway at this point. Phase 2, we are coming to you today to talk about funding for Phase 2, as well as we're talking to other funders as well. The rental housing tax credits will be applying to the Indiana Housing and Community Development Authority, IHCDA, by the end of July. And then by November, those tax credit awards, rental housing tax credit awards, will be made. So Phase 1 is on track to be completed by the end of this year. And then for Phase 2, we would go through full design, assuming we get awarded in November, we'll go through full design and would anticipate starting construction by September of next year and completing construction within about a year, by the September of the following year, 2014. So we will definitely are on track to have the funds obligated by that end of 2024 goal date. Next slide. So kind of hard to read little print, but it may hopefully a little bigger in front of you. The funding stack, the capital stack for these developments, as I mentioned, Phase 1 is underway. And it's kind of a poster child for this doing brick and mortar construction during the pandemic, in that when we applied for the funding, the time frame between application and allocation of the funds, and when we went through full design, by the time we went to the construction contract, costs had increased over $1 million. And so to be able to move forward, what we needed to do was twofold: value engineer to reduce costs, which we did, and then also look for other resources, again, why we're here tonight, but also housing opportunities. If you'll see, there's a line for sponsor and general partner loans. They have a substantial investment of their own funds at this point into the development, and that's not typical for these types of projects. That's not something that we usually see for our nonprofits. Their goal is to expand their capacity to continue doing affordable housing, and by investing a good chunk of change into a single development really hinders their abilities moving forward. So the question that you're going to ask me, if we can take less funds, yes, we can, always. But if we don't receive the $250,000 of the ARPA funds for Phase 1, it would actually mean that the housing opportunities investment would increase by that amount. That's kind of where we're at with that. We do have contingency funds, and we're continually looking at our budget and looking to do that other piece of bringing costs down whenever possible. But we'll talk about COVID challenges here in a minute. So Phase 2, a little bit different situation. For Phase 2, we are, on the front end, we're getting, we're applying for funding now, and we're using our crystal ball and looking at cost increases over the past year, 2 years during the COVID pandemic period, and costs they're not flatlining, they're continually increasing steeply. And so we are looking to layer in a lot of different resources into that capital stack so that we can move forward with that construction and be able to get it done within the time frame that we had talked about. So next slide.
Just under 5 minutes remaining.
Just under 5 minutes remaining.
Okay. We don't get 30?
We talked about combining the presentations we have too, but we can make
We'll talk fast. Okay, so The next couple slides, I'll just touch on. Rental housing tax credits is the primary funding vehicle for both of these phases of development. They're a federal program through the IRS that is administered by the IHCDA, Indiana Housing Community Development Authority, and the way that they work, it stimulates private investment into affordable housing. So the tax credits are allocated to a nonprofit agency or a for-profit, in this case a nonprofit, and private investors invest capital into the development in exchange for those federal tax credits. And so that's kind of the major funding vehicle in both of these phases. But in exchange for that, the developer then commits to keeping them as affordable housing for a 30-year period in which they lease the apartments to low and moderate income households. And it is a competition that one in about every 2 or 3 applications get funded. We did participate in an institute, a special institute that IHCDA has, and we have a good level of confidence that this project is going to get funded. So that's something that kind of gives us a little benefit there. Next slide. So, economic impacts from COVID. One area of our lives that have really kind of been highlighted through the pandemic is that housing stability and housing affordability are really closely linked. And so we both Housing Opportunities and Milestone have a passion for housing affordability, of really producing apartments that are affordable for folks to rent. But there's been a lot of focus on homeownership and the low amount of houses that are available for sale. And what happens with that, people aren't moving out of where they're at now, right? So they're not buying new houses, so they're staying where they're at. So we're also not only seeing a reduction in the amount of homeownership opportunities out there, there's also been a shrinkage of open apartments. And we've experienced that firsthand for this first phase development. We have temporarily, we relocate people out of their apartments so that the renovations can occur. And the amount of rental vacancies in Portage, I can tell you, are slim to none, and they are not affordable. So we're looking at apartments between $1,000 and $2,000. And even one instance had to relocate someone temporarily into an extended stay hotel because we just couldn't find rental opportunities that are out there. So nationally, the apartments vacancies, normally we budget, or we do operating pro formas looking at about 7% vacancy each year, and right now the national is 2.6%. So there is definitely a crisis need for additional affordable housing. I'll skip that for now. So construction costs, I mentioned, were skyrocketing. Inflation, I think we probably all know inflation for our country as a whole was pretty high last year. I think 7% was the dollar amount, or a percentage. For construction, it is more like 20% is what we are hearing from our general contractor corps that's working on these 2 phases. So they're experiencing a 20% increase in costs. An example of that, just very recent, is drywall. As of March 1st, there was a 30% increase in the cost of drywall. And in the olden days, in the before times, you would enter into a construction contract, and your contractor, that's what they would build it for, right? Because you have a contract. Now we have what's called escalation clauses. So that 30% increase, we wouldn't have had a 30% increase, but it would have been the contractor's problem. Now it's not. Now it's the owner's problem. So that's why we have gaps to fill even as we're under construction, because these little supply chain sort of interruptions and surprises come along. Interest rates. For a project like this, we have a construction loan, and we generally look at the trends of where the interest rates have been or where they're going, and they had been projected to increase slowly, and now they're increasing a lot more steeply. So the interest rates for these types of projects, there's a lot more construction interest than what we would have originally forecast. Am I out of time yet? So real quick, we are meeting the ARPA priority considerations in a lot of different ways. Probably the most important one to mention is that both of these phases, our home investment partnerships program and National Housing Trust Fund eligible. In fact, National Housing Trust Fund is a source of funds for Phase 2. And so that is specifically listed in the Treasury notice as a presumptive eligible use of the ARPA funds, or projects that are eligible for these. When it comes to leveraging, these both phases are highly leveraged, 98% non-ARPA funds for the first phase, 96% for the second phase. Just looking at the 30-year period, not even Jordan's 99-year period for the affordability with requirement promise for the exchange of the land, is that there would be about 6,500 residents that would benefit from these units over 30 years. And I think I heard a beep. Am I done? One more, okay. I can be done. You guys can read.
I have a couple of questions. One is, say you receive these funds and you finish your Phase 2, and it's opened up for families that need assistance. What guarantees can you offer this board that those opportunities are going to go to Porter County residents and not other counties' residents?
Sure, yes, that's.
Because as you know, I mean, these kind of programs, when you, especially a brand-new spanking building, you know, you might as well put a neon light on it, come here.
I might live there.
Yeah.
I don't think about it.
You know, I'm
We live in
sorry.
Porter County, so we can help you out.
How do you guarantee that?
Yeah, so we do extensive verification checks for income and all sorts of stuff like that. So that's part of that process as well, especially for the supportive housing side. Like we are required to only choose people from a list of Porter County serviced folks. So that's all part of that verification process. That's very time consuming and highly regulated from the funder's perspective. And we don't see a lot of movement from county to county in the folks we serve, because I think, you know, it's the nature of the people we serve. They're resource constrained, right? So it's very hard for them to move far from where they currently
Not
are.
very
to do that.
transient.
Exactly. Yeah.
The other question I had was, you know, outside of collecting rent, what else is your role once these facilities are built?
Yeah, so we own and manage the entire entity and project, so it's across the board. So we, staff it with our property management staff. We do our in-house property management, so we are working and seeing the residents every single day. We're service providers. We provide direct case management and resident services to both the folks who have disabilities and just our general residents as well. So it's being there on site every day and meeting folks and connecting them to services, and then coordinating those broader services for them overall as well.
So you maintain the property itself, the outside, the lawns, the garbage pickup, snow removal.
So we do that for all 210 units that we currently own and manage. So maintenance on staff and contracted, snow removal, lawn care, stuff like that.
So what do you do if you get an occupant in there that becomes a problem?
Yeah, sure. And that happens, with any multifamily housing that you have. You're going to have folks who are struggling and going through that.
That happens in rich neighborhoods. So.
Sure, yeah. And so the first thing we're going to do is try and work with that person to resolve the issue. We're in the business of keeping people housed, not putting people back in homeless situations or unsafe situations. So we're going to work with them and their service provider to try and resolve the situation as quickly as we can and get them outside services they may need that. And then ultimately, if we can't resolve that and they're still a nuisance to themselves or the residents or the broader community, then we're going to move to remove them from housing, just like any landlord would do. But we're going to, again, do that through a way to help them land somewhere else that it may be a better fit for them or go through that process.
Well,
Good answer.
will you have, I'm sorry, go ahead.
I was just curious what you're leasing, is it a 6-month lease or these yearly leases? How long do these actual houses actually go, or apartments get usually occupied for?
They're required to be a 12-month lease, so that's a funding requirement from the IRS perspective. And then our typical stay in one of our rentals is about 3.5 years, and then for our supportive housing, it's closer to 6 years. The folks stay in those apartments with us.
Now, your resource center, that's a collaborative case management? Are you working with Porter Stark and with other, the Y and that was mentioned?
Yep, so again, depending on what the service is, so the Y is going to do some nutrition classes in there, some cooking classes. Neo is going to be in there to provide adult education, GED, and other service connections for our population, again, for the broader community as well. Porter Stark will help out with the mental health side and provide direct case management for that population. And then we also provide direct case management, again, focused on the housing side of keeping people housed, and, a good tenant just like anyone else.
And that resource center will serve primarily, and there's nothing else like that in Portage currently, correct?
Great, yeah, just our great trustee's office there that provides those services.
And that will serve, not only the homeless population, but also the individuals in the units.
Yeah, it will definitely serve the homeless population, but the greater need is for people who need affordable housing and those service needs. So it will serve far more people who are just looking for an affordable place to rent, or who are looking for budget counseling, which we provide and other folks provide, stuff like that, general services and needs for the broader community and our residents.
And from your perspective, I know that you've combined both of these projects for purposes of presentation.
Mm-hmm.
But if we do a funding reduction, which I suspect all of them will be reduced.
Sure.
Do you need us to designate how much we're giving to Phase 1 or Project 1 and how much to Project 2 for your purposes? Because I know you indicated that the $250 on Project 1 needs to be separated out. So do you need us to divide our allocation?
It would be helpful. One thing I didn't mention during the presentation is that, the ARPA funds are highly leveraged otherwise, but also part of the kind of competitive scoring for the rental housing tax credits is leverage for that development. So we would need to be able to document leverage for Phase 2 specifically. So it would be helpful to have them split out.
And we would be happy to have that conversation about how that could work to
I just have
best suit you
a
guys.
quick question. First of all, very good presentation. Nice work that you're doing. Just a question on the timeline. You said the construction began in February of 2022. I assume you had a strategic plan of when these two phases were discussed and there was a decision to move forward prior to that. So this project has been on the books or has been a vision or a goal. And I just want to maybe just kind of some of the things you said. Are you asking for the funds and then you start talking about the rise of construction costs and things are going up for everybody.
Sure.
Are you requesting the funds because of the increase of your already, this project you were going to do prior to the pandemic? I guess my question, kind of a direct question, are you asking for ARPA funds because of the increase of cost?
Absolutely.
Because this is something you were already going to do?
Good question. So is this a request as an anticipation of those rising costs?
And so yes and no. So for Phase 1 in particular, we need additional funding because of increased costs that weren't there when we started the project, right? And then for Phase 2, I think it's both an anticipated cost that we know are coming now as we're talking to our general contractor and making that budget, and then also to leverage local funds to increase our chances of getting funded at the state level. So I think that's twofold in that way. Does that answer your question?
And just to add maybe a little bit more to it, for the rental housing tax credits being the primary kind of funding vehicle for both phases, for Phase 2, we are maxed out at what we can request. So we can't, that's why we're looking to layer in all those other resources because we can't get any more. So we can't, and with kind of the COVID impacts, the tax credits are, raise that capital. There's an investor that provides the capital in exchange for the tax credits, and it varies over time. There's a negotiation that occurs with the investor on how much they're willing to pay in exchange for the tax credits. And the pricing, when we did Aurora View, that's not that number. Bear with me 2 seconds. I'll get there. Was 89, almost 90 cents on the dollar that we received in equity from the investors. For Prominence 1, when we closed at, again, almost 89 cents on the dollar. Right now, we're budgeting at 83 cents, which every cent is about $120,000 of capital. So, even a few pennies, it sounds small when you talk about it in sense of pennies, but it really has a huge impact on the budget. And that is, that's directly from these pandemic times that we're in, and the investor appetite for the tax credits has softened. And over the years, it has gone up and down. This is some of the lowest numbers. Like I said, we've been doing this 22 years. This is some of the lowest we've seen. We've closed projects at 95 cents, 99 cents. Being down in 83 is really unfamiliar territory, but it is the reason why we need to look for other resources.
The city of Portage, I think I know the answer to this question. You get anything from the city of Portage on their federal money?
Nope. But they've been very supportive of the project and helping us get to this point of working at the design and phases like that.
Question regarding, it covers the entire 12 townships that would be supported. It's located in Portage.
Yes.
And there was a trustees presentation made. Does this tie in with that some way, and how does that tie in?
Sure, yep. So we met with Mr. Clancy and Mr. Harper and other service providers and housing providers to talk about the needs in the community, and that's what they kind of outlined at the last session was, some of those different needs and we kind of fit in that long-term stable housing category of providing that. So that was part of their presentation and request was this.
And so the dollar amounts, and perhaps Mr. Clancy could give us a little more information on how the two marry up and
Well,
but we're
it's actually,
talking dollars
it's
and
more than
cents.
two. What we tried to do was to get as much information as we could with all the different service providers that there were and that we deal with on a daily basis to make sure that we're not duplicating services and to learn about basically what everybody was doing and how they did it, and identifying emergency shelter, which is your township trustees, and that's your day or 2 or 3 days. Then you have your short term, which is your shelters, and then this would be basically the third level of preventing homelessness. And one thing that I learned through this process was that when you have things like this, people are going to work. They are going to work every day. They work hard. They're not moving in and out. They pay their rent. They do things right. So this is an important phase of not going back to phase 2 or phase 1. Especially now that when you see that the moratorium on evictions are over, we have not as trustees seen the impact yet. Because there was the emergency rental assistance from the state through the feds. There is all of our funds that we have available, all the different programs that are ending or have ended. So we're actually going to see this impact starting now. As I mentioned 2 weeks ago with the evictions that I was working on then, and it's going like this now. So I don't think that while some people may think the pandemic's over, the effect on those people and when those funds are gone, I think that's when you're really going to see the impact. And so without this, all you're going to do is to go back to phase 2 and then phase 1. So it's a natural progression. And that's kind of how we looked at it with all the different groups.
I got a couple more questions. So, Porter Stark was telling us how substance use disorder, mental health, and suicide are a big part of what's happened from this pandemic. But also, as I've looked at comprehensively the whole issue, this homeless issue appears to be a huge impact. Has that been your experience in housing opportunities, number one?
Yeah, for sure. And I think, it was an issue before COVID, but I think, it kind of put a spotlight on different sorts of issues.
And I know there's a comorbidity between the whole population. It seems to be a huge gap in services, though, finding housing, affordable housing, for people who are in shelter or who are in mental health treatment or in addiction treatment. This seems to be a huge piece that's missing across the county, Valpo and Portage.
Yeah, across the country, really, and we're no exception right here, too. And that's the piece, we also included with you a little news release from Prosperity, Indiana, in your packets there. Just came out a couple weeks ago. That really highlights that need for you of showing not only that there's no available for affordable housing, so I think the number is there's about 17 affordable apartments for every 100 low-income residents right here in Porter County. And that 88% of our low-income residents are extremely rent burdened. So that's that they pay 50% or more of their income every month toward their housing cost. And so that's some of the highest across the entire state, right here in Porter County, and that's what kind of just compounds those issues of homelessness. And that's where we see most of our homelessness, especially at the family level, is that kind of that cycle of not having an affordable place to rely on. So when an emergency happens, whether it's medical or car or whatever it is, then they're going to lose that housing because it's there's all of their income's going to that, and they can't afford to do both.
Last question I have, are you the only affordable housing provider in Portage right now? Because that's what I really liked about this particular proposal is that it's in Portage, because when we look at a lot of them, they're in Valpo, and a lot of the services are in Valpo. Is there anyone else actually providing affordable housing currently in Portage?
So not in a level of like this, and so Habitat, of course, does some work in Portage too, but they're doing kind of a house or two at a time, and so we're the only nonprofit affordable housing provider that I'm aware of that operates across the entire county, and then has the number of units that we can sustain in that way as well. And that's been part of our strategic plan, is to outreach to those communities that we are underserving. So we are very Valpo heavy because where we started and where our history's been. But we do have 38 apartments now, and if both of these phases go through, we'll add an additional 72 through this process. So it's a good fit for the city of Portage and a high need, and some of the other communities in LaPorte County that we're outreaching to as well.
How long have you been in operation?
Almost 25 years. Yeah. 25.
25.
I have one last question. Do you guys require people to take actual budget management classes if they're in your housing facilities? What are your guidelines for if they're staying there? Do they have to, do some classes just to, figure out how to manage their funds appropriately?
So it's not required. So it's kind of two different levels, right? So we are a HUD certified housing counseling agency as well. So we have 2 staff members who are trained and certified by HUD to provide rental counseling, credit repair counseling, pre- and post-purchase homeownership counseling, and all sorts of different things like that. And so we offer that service, but we do it in a couple different ways, right? So our rentals are, I like to describe them as they're rentals just like anywhere else, except they are at a level of rent that's well below market rate. And so those folks are just normal folks who need a place that's affordable to them, right? They're working at places that we go to every day, and they just need an affordable place to rent. So it's not necessarily that they need help budgeting, they just don't have enough income to support that. That service is available to them, and we offer that and market it to them. Our staff are there at one of our buildings in LaPorte today offering that service. So we'll do that, but it's not required. Where it does become a requirement is when someone is chronically late on rent, or kind of at risk of eviction or not getting a lease renewed because they're not able to pay. Then we'll kind of offer that service and say, hey, if we want, if we're going to continue for you to lease here, we need to get help with your budgeting and that service in that way too. But really, it's an incentive and an option for people to use, just like most services that are available in the community. It's not mandated, but there and highly encouraged especially when necessary.
Any other questions from the board? Do you have any questions of us? A question or two?
I don't think so.
Okay. Just so you know, the rest of the presenters that are still in the room here, is that we will score your request. That is sent off to the steering committee. Steering committee evaluates it and sends it off to the Board of Commissioners, and the Board of Commissioners then sends it off to the County Council. So, if that wasn't confusing.
So what that means is what we do probably doesn't matter.
No, it matters a great deal. And to let you know that there will be requests out of the many that we have received that will be fully funded. There will be some that will be fully funded. It's just going to depend on those applications. And by the way, I think any application that we have received was legitimate, and there's a need there. But there are some that are clearly, there's a much greater need than others. And those are what we're going to try to focus on. I believe we received roughly $54 million worth of requests, and we have roughly $28 million to hand out. So we've got to be smart with it, and we want it to be the most reaching and effective to our residents and the people who really need the help. So, good job, though.
Thank you. Yeah, we appreciate all your time. Thanks so much.
Thank you.
Commissioner Biggs?
Yes, sir.
Say one thing. As long as all the applicants are here, there were several references to being able to obligate the funds by December 31st, 2024. And while that deadline is what's in the Treasury's final rule, the steering committee moved that deadline up to July 1st, 2024 to be able to obligate the funds in any contract. It doesn't sound like from the gist of your presentations that would be a problem, but I just wanted to point that out to the three of you.
Thank you to everyone.
Wow, I'm done early again. I like this committee.
Get to our business.
All of the rest of them are.
Marathons?
Yeah. Like some of your council meetings.
Are we doing public comment?
Oh, I'm sorry.
So much for my joy.
Trying to push us out of the room.
He's leaving.
Any public comment? Nothing? Good? We are in recess. Thank you.